Ever seen those thyroid tests that look, well, a bit weird in a really sick patient, but they don't seem to have actual thyroid symptoms?
Uh-huh. Happens quite a bit.
Yeah. So today, let's jump into this interesting condition, Sick Euthyroid Syndrome.
Exactly. We're doing a focused deep dive. Some people call it Non-Thyroidal Illness Syndrome or maybe low T3 syndrome. Lots of names.
Right.
But the goal is simple. Understand what it is, why it happens when someone's unwell, and what it actually means without getting too bogged down.
Okay. So covering the essentials definition, causes, all the way through to management and what to expect.
That's the plan.
So starting right at the beginning, what exactly is Sick Euthyroid Syndrome in simple terms?
Okay, so at its core, it's basically abnormal thyroid function tests.
Yeah.
Your T4, TSH, maybe T3 in someone who is definitely ill with something else.
Okay.
But crucially, their actual thyroid gland is fundamentally healthy. It's not primary hypothyroidism or hyperthyroidism.
Okay. So the thyroid itself is fine.
Right. Think of it like this. A sick person, their tests look a bit sick too, but the thyroid itself is sound. The overall illness is driving the changes.
Sick tests sound thyroid. Got it. That's a helpful way to remember it. So what actually causes these changes? Why does the body do this?
Well, the honest answer is it's complex and not entirely pinned down. It seems to be a mix of things. Disruptions in the whole brain pituitary thyroid communication system, the HPT axis.
Right, the signaling.
Yeah, and also the direct effects of the systemic illness itself.
Right.
Things like inflammation, cytokines, they play a big role, and some medications too.
Okay, so inflammation, illness severity. What about specific risk factors? Who is more likely to develop this?
It's definitely more common in people who are significantly unwell. Think acute, severe illnesses like sepsis, major trauma, extensive burns.
Right, the really critical stuff.
Exactly. Also major surgery, chronic conditions if they're severe, malnutrition, and organ failure, especially liver or kidney failure.
And you mentioned medication.
Yes, certain drugs can contribute. Glucocorticoids, like high-dose steroids, are a classic example that can affect the levels.
Okay, so mechanistically, what's going on inside the body? How does the illness actually change those T4 and T3 levels?
The main mechanism, the one most often cited, is a decreased conversion of T4 into T3.
Okay.
T4 is, more of a prohormone, less active. T3 is the really active thyroid hormone, so you get less active hormone being produced from the T4 pool.
I see. Less activation.
Precisely. There can also be changes in the proteins that bind thyroid hormones in the blood, affecting how much is free and available, changes in transport into cells, metabolism. It's multifaceted.
And is there a reason why the body might do this? You mentioned inflammation.
Well, one theory, and it's quite interesting, is that it might actually be an adaptive response.
Adaptive. How so?
The idea is that by lowering the levels of active thyroid hormone, the body might be trying to sort of conserve energy and reduce metabolism during times of severe stress or illness, like a protective mechanism.
Huh. That's a different perspective. So it might not be inherently bad in that context.
It's debatable, and context is everything, but it's a prominent theory. Now, the challenge clinically is distinguishing this from, true thyroid disease.
Right. That seems crucial. What are the main things to differentiate it from?
You absolutely need to rule out primary hypothyroidism or hyperthyroidism. Those are actual problems with the thyroid gland.
Okay.
And also central hypothyroidism, which is a problem higher up in the pituitary or hypothalamus. Plus, other non-thyroidal conditions can sometimes mess with the tests too.
So careful interpretation is key. How common is Sick Euthyroid Syndrome, generally speaking?
It's actually very common, particularly in certain settings. You see it a lot in hospitalized patients, especially those with severe illnesses or in intensive care units.
So quite prevalent in ICUs.
Definitely. The exact figures vary, of course, depending on the patient group and how sick they are.
Okay. Now, clinically, what would you actually see in a patient? Are there specific signs or symptoms of Sick Euthyroid Syndrome itself?
This is a really important point. Generally, no. The key feature is often the absence of typical thyroid symptoms.
Okay.
You won't usually see the classic goiter, the eye signs of Graves, the specific skin changes of hyperthyroidism.
So what do you see then?
You see the signs and symptoms of whatever is making them sick in the first place.
Right, the underlying cause.
Exactly. Fever, malaise, fatigue, weight loss, maybe confusion or altered mental status if they're very unwell. It all relates back to the primary illness.
That makes sense. So if you suspect it, what investigations are needed?
Well, the core tests are the thyroid function tests, TSH, free T4, and often free T3.
The usual panel.
Yes, but interpreting them requires context. Knowing the patient is acutely unwell is critical. You might see low T3, maybe low or normal T4, and TSH can be low, normal, or sometimes even slightly high, especially during recovery. It can be confusing.
So the pattern can vary.
It can. And of course, you'll be doing lots of other tests to figure out the main underlying illness and assess its severity. The TFTs are just one piece of the puzzle.
Okay. So once you've identified it, or at least strongly suspect it, how is it managed? What's the treatment?
The absolute priority, the number one thing, is to treat the underlying illness.
Focus on the root cause.
Absolutely. That is the definitive management. Get the sepsis under control, manage the heart failure, support nutrition, whatever the primary problem is.
And what about giving thyroid hormone? If the T3 is low, shouldn't you replace it?
Generally, no. That's usually not necessary or helpful unless the patient has a known pre-existing thyroid condition that requires treatment anyway.
Okay, so treating the numbers alone isn't the goal.
Not typically in sick euthyroid syndrome. In fact, some studies have suggested giving thyroid hormone in this setting might not improve outcomes and could potentially have risks. So standard practice is to hold off unless there's clear evidence of underlying primary thyroid disease.
Right, and what's the usual prognosis if you treat underlying illness effectively?
The prognosis regarding the thyroid function itself is generally good. As the patient recovers from their primary illness, the thyroid hormone levels usually normalize on their own.
That's reassuring.
It is. The overall outlook, of course, really hinges on the prognosis of the underlying condition that caused it all.
Makes sense. Are there any specific complications from the sick euthyroid syndrome itself, or is it all related back to the main illness?
Yeah, the latter, really. Complications arise from the primary condition, the sepsis, the trauma, the organ failure. The abnormal thyroid tests are more of a marker of illness severity rather than a direct cause of complications themselves.
Okay.
So again, effective treatment of the underlying condition is the key to preventing complications associated with the illness.
So to sort of wrap this up, the big takeaway message seems to be, if you see abnormal thyroid function tests in a very sick patient, pause. It might not be a thyroid problem per se.
Exactly. It's often a sign that the body is under significant stress from something else entirely. Think of it as the thyroid reflecting the overall systemic storm. Right. Focus on treating that storm.
Precisely. Treat the patient, treat the underlying illness, and the thyroid tests will usually sort themselves out as the patient recovers.
It's a fascinating interplay. Makes you wonder, doesn't it? What other ways might our body's systems communicate during severe illness in these kind of unexpected ways?
That's a great question to ponder. The endocrine system is full of complex feedback loops that react to stress.
Definitely food for thought.
Yeah.
And just before we finish, for anyone listening who might be preparing for exams like the MSRA.
Oh, yes, good point. If you're revising, do check out pathomsra.com. And there's also freemsra.com for more resources, really helpful stuff there.
Great tips. Well, thanks for diving deep into sick euthyroid syndrome with us today.
My pleasure. Always interesting to discuss these clinical nuances.